Well, if this mother's story doesn't have you signing up for a CPR class, nothing will. Health Watch is coming up next. This week is National CPR and AED Awareness Week, with the goal of encouraging cities across the nation to establish organized programs to train the public on how to save lives. In this week's Health Watch, Dr. David James shows us why it's so important to know basic CPR.
It was another warm summer day just last year when Tanya Willis and her 4 children were enjoying a swim in the pool at the family's Middleton home.
And Maddie, who was 2 at the time, had her floaties on and had been jumping in the water off of the ladder, and she loved it when her head would go underwater and she'd bob back up.
By the afternoon, the family had decided to call it a day and headed inside to change. Tanya left young Maddie in the kitchen and went quickly to change. By the time she returned, Maddie was missing. The family frantically began searching with initially no luck, but then they looked in the pool.
And she was in the pool about 3 or 4 feet from the ladder, and she was floating face down, and all you could see was her diaper and her little pink dress.
The family called 911, and the operator on the other end was able to guide Tanya through the steps of CPR. The procedure ended up saving young Maddie's life.
And I don't remember exactly how many repetitions it took, but after probably 5th or 6th set of compressions and breaths, I felt her heart beat.
This time the story has a happy ending, but unfortunately other times the ending is far more tragic. Being able to apply CPR is a skill that is invaluable when an unexpected crisis arises. For this week's Health Watch, I'm Dr. David James.